Welcome back. I'm here with Dr. Nathan Bauer from 417 Smiles and Dr. David Struble from Sleep Better, Missouri. Gentlemen, thanks for being here. We're going to talk about something that's kind of near and dear to my heart, and that's sleep apnea.
Sure.
Also may be surprising that dentists can be involved in the whole process of helping people out. First of all, what exactly is sleep apnea?
You know, sleep apnea actually means no breathing. And for a lot of folks, unfortunately, that happens to them many, many times during the night. Sometimes 10 seconds at a time, sometimes a minute at a time.
Oh, yeah.
So it's a very serious problem.
We had that with my father, as a matter of fact. It was long enough that people would start getting up out of their chairs to make sure he was okay.
Gotta go help him.
Right. Well, okay, how can you tell if a loved one or, someone has sleep apnea?
Well, the obvious things where they actually hear you snore very loudly, they actually can time it almost when you stop breathing. Those things can be observed by someone else. But we can also do screenings on people, a little questionnaire that asks specific questions that will let us know whether or not they are at high risk for having sleep apnea. You can't tell by looking at someone.
Right.
You literally have to be evaluated by a board-certified sleep physician, and you have to be tested. And for a lot of people, they have heard of these sleep tests that they do at the hospital where they have to go overnight.
Oh, yeah. I've been there, done that.
Fortunately, nowadays, in a lot of cases, they don't necessarily have to do that. They can do home sleep testing now that gathers a lot of good information that you can oftentimes diagnose from that. And a lot of folks would rather sleep in their own bed.
Well, okay, now you mentioned taking the sleep testing and, a certified physician who is, versed in this. Where does the dentist fit in something like this?
Sure. So at our office, the dentist, we have an advantage because, we see patients regularly. We're looking in their mouth regularly. And so, we're used to seeing kind of what the inside of somebody's mouth is, what their airway looks like. And what we've done kind of in partnership with David's company is we offer the screening so we can kind of assess whether or not a patient is at risk for sleep apnea. And the screening's really simple. It's just a series of some questions and a neck measurement. It goes into a little formula, and if you're above the threshold, you're more at risk, and if you're below the threshold, then you're not as at risk. And so for those patients that are at risk, we then refer them over to David's company, which is the Sleep Better, Missouri.
Now, when you talk about the CPAP machine, people talk about masks, and I've talked to so many that have said, I can't take this mask. There is more than just masks, more than just CPAP machines that can help with this.
Absolutely. In fact, as dentists, and most dentists can do this type of treatment, but oral devices nowadays are very effective. They help to maintain the airway and keep it open, and in mild to moderate cases, it can be just as effective as a CPAP.
Okay, now explain how important this is. It's more than just snoring or being tired. It can be a lot more than that.
Oh, and in fact, it usually is more than that. People that have sleep apnea, they can be 5 times more likely to have heart disease. They're 2 or 3 times more likely to have diabetes. Chronic fatigue, chronic tiredness, people that just can't make it through an afternoon without a nap. Irritability, depression. There's even studies that show it as a link to Alzheimer's disease. All of these things are very, very vital, obviously.
So as you've heard, check with your doctor, check with your dentist. The mouth is kind of the first airway to the lungs, everything like that. Check it out. Sleep apnea, apnea is a lot more than just snoring. Yes. Doctor, thank you very much for being here to both of you.
Thank you, Tom.
We'll be back.